Jeff Kenkel. I'm a plastic surgeon in Dallas, and I'm happy to report to you on a paper we just published in the Aesthetic Surgery Journal dealing with the effectiveness of prophylactic antibiotics in outpatient plastic surgery. This is a level 3 study, which is a retrospective study that reviewed about 1,800 patients, and from that 1,800 patients we pulled out a cohort of about 460 patients that underwent larger, more complex outpatient plastic surgery procedures. There's a lot of confusion in the literature as to the importance of prophylactic antibiotics as well as the timing of such. The CDC recommends that prophylactic antibiotics be given to the patient somewhere between 60 and 120 minutes. This is in direct contrast to the SCIP measures, which is the Surgical Care Improvement Project, which recommends that the antibiotics are delivered within 30 minutes of the incision. The importance of this article is emphasized by the lack of consistent guidelines recommended for outpatient plastic surgical procedures. Within our cohort of patients, we looked at a number of different complications that may arise following these procedures, including wound healing problems, wound dehiscence, delayed healing, cellulitis, and other potential complications. Our first group of patients underwent infusion of antibiotics less than 30 minutes prior to their incision. The second group, it was greater than 30 minutes. And what we found was that the first group actually had a statistically significant reduction in complications compared to the second group. We further stratified the cohort of patients and compared about 25% of the patients who underwent no further treatment with antibiotics postoperatively to 75% that actually had anywhere between 24 hours and 7 days of antibiotics given. What we found when we compared those two, that there was absolutely no difference in complication rate in either of those two groups. There are limitations to this study due to its retrospective nature. Additionally, physician reporting was heavily relied upon, which can have its inconsistencies. However, we felt this was a good start to putting something in the literature regarding the use of prophylactic antibiotics, both prior to surgery as well as after surgery. Obviously, prospective studies would be more accurate at breaking down these cohorts and further delineating the role of antibiotics around implants. So in summary, this study evaluated the effectiveness of prophylactic antibiotics prior to outpatient plastic surgical procedures. We found that if the antibiotic was given somewhere between 0 and 29 minutes prior to the incision, that the complication rate was significantly lower than those who received antibiotics 30 minutes or greater. Furthermore, there did not appear to be a benefit of continuing antibiotics after these outpatient plastic surgical procedures.